The position you sleep in tonight may be quietly damaging your heart. Not a little, not in a way you'll feel tomorrow morning, but cumulatively, over months and years, the wrong sleep position compresses blood vessels, disrupts circulation, and creates the exact conditions cardiologists associate with blood pooling, clot formation, and in the most serious cases, stroke and thrombosis during the overnight hours. While you sleep, while you're completely unaware, while your body should be repairing. Most people have never had this conversation with their doctor. Most doctors have never raised it. The reason it stays hidden is the same reason it's so dangerous. It feels like nothing. You lie down, you get comfortable, you fall asleep, and for 6 to 8 hours, your cardiovascular system silently absorbs the mechanical consequences of a position nobody told you to question. That ends today. I've seen patients arrive on my table after preventable strokes. I've reviewed histories where the contributing factors weren't lifestyle, weren't diet, weren't genetics. They were structural, positional, something as simple as the way a person arranged themselves in bed every single night for a decade. This is something most people are never told, and it is something you deserve to know before tonight. Here is what your body actually does while you sleep. Most people think of sleep as a passive state. Rest, stillness, recovery. In one sense it is. Heart rate slows, metabolic demand drops. The brain consolidates memory and clears waste. But the cardiovascular system does not go offline. It shifts into a lower demand mode, still dependent on adequate blood flow, unobstructed vessels, and consistent oxygen delivery to every tissue. In this lower demand state, the body has less capacity to compensate for physical obstruction. During the day, upright and moving, blood is assisted by muscle contractions, postural changes, and a cardiovascular system running at higher output. Obstructions get overridden. Lying still for 7 hours is different. When blood flow is restricted by positional compression, the body cannot easily self-correct. Vessels remain compressed. Blood slows. In areas of slowed flow, the clotting cascade, the mechanism that forms protective clots around injuries, can activate inappropriately. Deep vein thrombosis. Clots forming in the legs from prolonged vascular compression during sleep. Not from injury. From stillness, in the wrong position, in vessels that have already stiffened and narrowed with age. After 60, this risk is not theoretical. Reduced elasticity, narrowed lumens, slower circulation, positional compression produces more significant flow restriction than it would in a younger body. The margin for error is smaller. The consequences of getting this wrong are larger. Sleep position is not a comfort question. After 60, it is a cardiac question. Most people believe sleep position is a matter of preference. Whatever feels comfortable is probably fine. Strokes happen because of disease or genetics, not because of which way you turned over before closing your eyes. Each of those beliefs is wrong. Comfort and safety are not the same thing. The positions most people find naturally comfortable are often the ones creating the most sustained cardiovascular stress. The body settles into what feels good, and over decades, those positions reshape how blood moves, how vessels are compressed, and how much strain the heart absorbs during the hours it most needs to rest. Strokes are not random. The hours between midnight and 6 am carry the highest stroke and cardiac event risk of the entire 2-4 hour cycle. That clustering reflects what happens during sleep-reduced compensatory capacity, lower cardiac output, and in people sleeping in the wrong position. Sustained vascular compression at precisely the moment the body is least equipped to respond. Sleep position matters. The evidence is unambiguous, and the first position you need to understand is the one most people choose without a second thought. The most dangerous position: sleeping on your stomach. If you sleep face down, chest against the mattress, head turned to one side, you are in the position that creates the most sustained cardiovascular stress of any common sleep posture. Your chest is compressed for the entire duration of sleep. The lungs cannot fully expand. Oxygen saturation drops measurably during prone sleep compared to side or back sleeping. In younger people with healthy lungs, this is compensated for. In people over 60, with any degree of reduced lung capacity, it is not. Less oxygen in the blood means less oxygen delivered to the heart muscle. The myocardium is among the most oxygen-dependent tissues in the body, with almost no reserve capacity to function under reduced oxygen without increasing its own workload. A heart working harder to deliver less oxygen for 7 hours every night. The neck is rotated to one side for the entire duration. The carotid artery on that side, the primary blood supply to the brain, is compressed and kinked. Research in the journal Stroke found that carotid compression during sleep is associated with reduced cerebral blood flow. In a person with any existing carotid, narrowing extremely common after 60, that compression compounds an already reduced flow. The arms are often pinned beneath the body or extended overhead. Brachial plexus compression, radial artery compression, and the lower back is hyperextended, compressing the lumbar spine and the vascular structures alongside it. Stomach sleeping is a full-body vascular compression event sustained for hours. A large-scale study in arteriosclerosis, thrombosis, and vascular biology found prone sleeping associated with a 21% higher risk of cardiovascular events in adults with existing arterial disease. In people over 60, most of whom have some degree of arterial change, that number is directly relevant. 21% higher cardiovascular risk. From a sleep position, every single night, do you wake up with numb hands, brachial plexus compression from arm positioning, swollen legs in the morning, impaired venous return from pressure on the inferior vena cava, headaches on waking, reduced cerebral blood flow from carotid compression, morning fatigue that sleep doesn't resolve, the heart and lungs working harder than they should for 7 hours, occasional early morning palpitations, the autonomic nervous system responding to overnight oxygen variability? These symptoms are common. Most people blame age, the mattress, how late they stayed up. In people who sleep on their stomachs, they are often direct cardiovascular signals from a body that spent the night in mechanical distress. I want to tell you about a patient, a 6-8-year-old retired nurse, someone who knew her own body and paid attention. She came to me after 6 months of symptoms repeatedly dismissed, morning fatigue that didn't lift until midday, numb hands on waking, a mild headache behind the eyes, there most mornings, gone by 10 a.m. 3 appointments, 3 explanations, dehydration, screen time, stress. The question nobody had asked her, how do you sleep? Face down, she told me, always had, since childhood, the only position she found comfortable. We discussed the mechanisms and worked through a transition plan to a safer position. 12 weeks later, the morning headaches were gone. The hand numbness had stopped. The fatigue was lifting before 9 a.m. Nothing changed except the position. Not a remarkable case, a representative one. And the reason this conversation matters. Stomach sleeping is the worst, but every common sleep posture has a different cardiovascular profile, and understanding all of them gives you the full picture. Second most harmful, flat back sleeping with no elevation. Sleeping on your back sounds sensible. No chest compression, no neck rotation, spinal alignment. But flat back sleeping without elevation is the position most associated with sleep apnea. The tongue and soft tissues fall backward under gravity, partially obstructing the airway. Oxygen levels drop. The brain fires a stress response, cortisol, adrenaline, heart rate spike that can happen dozens of times per hour without fully waking the person. 3 times higher risk of heart attack, direct contribution to hypertension and arrhythmia. Flat back sleeping without modification feeds that cycle. Third, right side sleeping. Right side sleeping reduces sleep apnea risk compared to back sleeping, a real benefit. But gravity pulls the heart toward the right lung. The mechanical load on the inferior vena cava, the large vein returning blood from the lower body, is higher on the right side. Venous return is less efficient. For people with existing heart failure, right side sleeping is associated with worse symptom control and higher overnight cardiac strain. Without heart failure, the difference is subtler, but in a body over 60 with reduced cardiac reserve, subtle mechanical disadvantages accumulate. Better, left side sleeping. The inferior vena cava runs along the right side of the spine. In the left lateral position, gravity assists venous return. Blood flows back to the heart more efficiently from the lower extremities. In people with venous insufficiency, varicose veins, or leg swelling, this meaningfully reduces overnight blood pooling. The heart is not compressed against the lung. Breathing is unrestricted. The airway remains more open than in back sleeping. Gastroesophageal reflux, one of the most common sleep disruptors in adults over 60, is significantly reduced because the stomach's position creates a natural barrier to acid reflux. Multiple studies, including research in the American Journal of Gastroenterology and Journal of Clinical Sleep Medicine, found left-side sleeping associated with better sleep quality, reduced overnight blood pressure, and lower cardiac strain compared to right-side or back sleeping in older adults. Best, left side sleeping with correct elevation and alignment. Left side sleeping is the foundation. Optimization is what turns it into genuine cardiovascular protection. Head elevation of 10 to 15 centimeters above the heart. Not a decorative pillow stack, a specific angle that keeps the airway open, reduces nocturnal blood pressure, surges from airway obstruction, and prevents fluid accumulation, contributing to morning eye pressure and facial swelling. A firm pillow between the knees is not optional. It maintains hip and spinal alignment, preventing the upper leg from rolling forward and rotating the pelvis, a rotation that compresses lower lumbar vessels and causes the back pain many side sleepers report. The bottom arm extended forward, not tucked under the body. Tucking creates the same brachial plexus compression as stomach sleeping. Extended forward, blood flows freely through the axillary vessels. A small pillow or rolled towel supporting the waist eliminates the lateral lumbar gap that causes side sleepers to unconsciously tense the lower back through the night, sustaining sympathetic nervous system activation that keeps overnight cortisol slightly elevated. These are the difference between left-side sleeping as a good position and left-side sleeping as an optimized cardiovascular environment for 7 hours of overnight repair. Here is your implementation plan. Tonight, if you sleep on your stomach, you will not transition by willpower alone. Sleep position is comfort habituation built over years. Forcing an uncomfortable position produces fragmented sleep, which creates its own cardiovascular problems. Begin tonight by placing a firm pillow or rolled blanket against your abdomen on the left side. When you roll toward your stomach, the pillow provides resistance without waking you fully. Over 2 to 3 weeks, your body adapts to stopping at the side position. For back sleepers concerned about apnea, head elevation plus a positional pillow preventing full rollback. A wedge pillow achieves both. For the optimized left side position, a pillow holding your head at 10 to 15 centimeters above the mattress. Measure with your hand, not by stacking until it feels comfortable. A firm pillow between the knees, bottom arm extended forward. No equipment unavailable in any home. No cost beyond a second pillow. Within 3 to 5 days of consistent left side sleeping, most people report clearer morning breathing and reduced facial swelling. Within 2 weeks, morning headaches from nocturnal circulation issues typically diminish. Within a month, the reduction in overnight cardiac strain shows in lower morning blood pressure and improved resting heart rate. 3 mistakes that undermine the benefit. Over-elevation. Above 20 centimeters creates a neck angle that increases carotid strain rather than reducing it. 10 to 15 is the therapeutic range. More is not better. Soft pillows that collapse. A pillow comfortable for 20 minutes, but flat by midnight, provides no sustained benefit. Firm, dense fill maintains the angle throughout sleep. Inconsistency. The cardiovascular benefit is cumulative and dependent on nightly repetition. Alternating positions nightly resets the adaptation. Commit to the position. Use the transition pillow. Give it 3 weeks. Your sleep position is either helping your cardiovascular system recover overnight or adding to the load it carries during the day. There is no neutral. For 6 to 8 hours every night, gravity, compression, and alignment are working on your blood vessels, your heart, your airway, and your brain in your favor or against you. This is not just aging. It is not irreversible. It is mechanical, and mechanics can be changed. You have a different option tonight than you had this morning. A specific position, a specific setup, a specific transition plan, all of it actionable before you lie down. What position do you sleep in right now? Will you try the left side setup tonight? Tell me in the comments. I read every single one. Your answer helps others in this community know what's common, what's working, and what needs to change. If this was useful, share it with someone over 60 who has never thought about what their sleep position is doing to their heart. That share might change what happens in their cardiovascular system every night for the rest of their life. Everything I've shared is general medical information based on current research and clinical experience, not personal medical advice. If you have heart failure, atrial fibrillation, severe sleep apnea, or structural cardiac conditions, discuss sleep positioning with your cardiologist before making changes. Take care of your heart. It works every minute of every night without rest, without complaint, without asking for anything. Give it a better environment to work in. Starting tonight.